Hello again. Now, since the unbanning of alcohol a week ago, emergency rooms have been flooded with victims of alcohol-related incidents. The South African Medical Research Council predicts around 5,000 people per week will be hospitalized. Now, this doesn't only strain the health system, it also puts victims at risk of contracting COVID-19 in ICU rooms. We're joined by Professor Charles Perry from the South African Medical Research Council via Skype from Cape Town. Thank you very much for your time this afternoon. So the modeling that you looked at of the 2.2 million trauma cases in South Africa each year, 40% are alcohol related. That's quite concerning.
Yes, that's been a trend over a long period of time. And I think the lockdown that we had on this, the ban on sales of alcohol, is just sort of reminding us of just how serious a problem it is. In fact, our model predicts that with the making available of alcohol, we'll have about 5,000 new alcohol-related trauma cases coming back. And that's only about half of the alcohol-related trauma cases that disappeared because of all the strict lockdown provisions. So it really is creating quite a burden, and we're starting to see, in fact, that is in fact coming true. We are seeing a doubling or even a trebling of some of the trauma cases now during the first week since the alcohol sales resumed, but it's still not as high as it is normally during when we don't have any of the lockdown provisions.
I'd like us to expand on that last note that you just made. What has the data from various hospitals revealed since the unlifting of the ban on alcohol sales?
Yes, thank you. Basically, I mean, I've only got information from 7 hospitals so far from 4 different provinces, and they're all saying pretty much the same thing, although some more than others. So, for example, I'll go through them very quickly, and some of it comes from the media, some of it from contact that I've had with people and so forth. In KwaZulu-Natal, there was a report in the Sunday Times of a trebling of the trauma cases in the first week of June. From a private hospital, Mill Park in Gauteng, a doubling of trauma admissions, back up to about 70% of all admissions, from a drop down to 30% during the lockdowns 4 and 5. At the Charlotte Macnache Hospital in Gauteng, reporting a 214% increase in assault cases in the first 3 days of June compared to a period before that in April. Car accidents going up by 500% at that same hospital in the first 3 days of June compared to the average for April. Chris Hani Baragwanath Hospital seeing a 290% increase in trauma cases per day on the 1st of June as compared to the average for May. At Groote Hospital in the Western Cape, during level 4, they would see approximately 8 trauma patients per day. In one 12-hour period after the ban on alcohol sales was lifted, they had 28 patients. That's a more than 250% increase. Heidelberg Hospital, almost done here, reporting a 79% increase in trauma patients. Most of them were alcohol related. This is on Monday the 1st. And at a big public hospital in the Northwest, reporting a 150% increase in assault cases on Monday the 1st of June compared to just before that at the end of May. So, and taking the average of those, we're seeing roughly a 230% increase in trauma admissions, as I said, compared to lockdown level 4, but still probably not up to the levels that we would see before the lockdown, because there's still certain provisions that are keeping people off the roads, and we're not seeing certain kinds of trauma as a result of that. But certainly, quite likely, we are up to the 5,000. If we could get data from all approximately 400 public hospitals, we'd probably be close to the 5,000 cases we reported would have come back once the alcohol sales resumed.
What does this mean in terms of consequences for healthcare workers? It's not just about availability of beds, but this could mean that they would be stretched on other things when we know we're dealing with this pandemic.
Certainly that's the case, and I heard a case from somewhere in KwaZulu-Natal where the hospital said that they'd had 22 assault cases and 8 motor vehicle cases, and they couldn't have any admissions for COVID-19 patients because they were just fully occupied. And certainly, and at the Chris Hani Chris Hani, Baragwanath Hospital, the CEO, on last Monday, reported that she feared a spillover from the trauma units into the medical side. So certainly these cases, they take a lot of time to fix up. I've heard cases of axe wounds to the head, stabbings to the stomach, and so on, and often alcohol fueled. And then they take surgery, 1 or 2 surgeries, and they can end up being in the ICU as well. So there'll be competition for doctors' attention. Many of the trauma doctors have been roped into medical cases, but now they'll be called back to deal with these traumatic injuries. So we'll lose that capacity. And if medical professionals get sick, get infected with the coronavirus, there'll be strain on personnel, and so that'll create a stretch too. So it's certainly not something we want to see, but it certainly was inevitable unless we'd taken stricter steps to deal with the to limit the harm associated with trauma. But I think really we just opened up the floodgates by letting all on and off consumption alcohol outlets sell again on the 1st of June.